All right, why don't we go ahead and get started? Hello, everybody, and thank you for joining us today for Benovate Explores. This is our monthly webinar conversation on health and risk in an ever-evolving industry. My name is Catherine Rowe, and I'm the lead content specialist here at Benovate. And I have Mike Larkin joining me today. He's our senior business analyst. For those of you that are joining us for the first time, I want to welcome you here. This is the second quarter of our webinar series, and we're focusing on member engagement and just what that means to any sort of wellness program or endeavor. Joining us today are a few representatives from AirCare. We've been partnering with them as an add-on program to our platform. So we'll be diving in just a moment here, but just so you know, we will be having time for Q&A at the end of our session. So if you have questions, then hang on to those, or feel free to tweet those to @Benovate, #BenovateExplores, and we'll get to those at the end of our session. So why don't we go ahead and get started with a little introduction. So our two guests today are Sarah Thompson, Director of Clinical Operations, and Sophia Holcomb, Senior Health Plan Strategist from AirCare. And I want to thank you both for joining us today. And would you mind just giving us a quick introduction on what your roles are at AirCare?
Sure. Do you want to go first?
Sure, I'll get started. I'm Sophia Holcomb. I'm the Senior Health Plan Strategist here at AirCare. In my role, I'm responsible for meeting with clients or prospective clients and helping understand some of their challenges or issues that they see around behavioral health within their organization or their health plan, and help tailor our model and build a custom solution for them that addresses those issues.
And I'm Sarah Thompson. I am the Director of Clinical Operations here at Air Healthcare. I am a clinician by training, so my graduate degree specializes in addictions. I've worked with and in some of the leading co-occurring treatment centers across the country. And now, working as the Director of Clinical Operations, I try to take that clinical knowledge I've gained, share it with the other clinical staff, and make sure that we're providing a service that is clinically sound, is going to give employers and our clients the return that they're expecting, and we do it with integrity and merit.
Excellent. Well, thank you. So now that we know what you do, would you mind giving us a little bit more background on just AirCare and what the story is with AirCare? What's your mission? What do you typically try to accomplish within your program?
Sure. AirCare, we've been in business in the behavioral healthcare space for over 16 years. As of the last, say, 5 years, we've been partnering with employers and health plans, TPAs, to help them manage their behavioral health populations. So as a behavioral healthcare company, we use claims data analytics and machine learning to help find individuals that could benefit from behavioral health services, whether that's they have a diagnosed need through their claims, or they have an unmet need. And then Sarah and her clinical team helps them through clinical interventions. Do you have anything to add to that?
Yeah, I think what's different from our company than any other company out there on the market is that a lot of companies have clinical intervention and a lot of companies have the claims analytic. We're one of the only companies that does both. We have the proprietary information to be able to run all sorts of data, including pharmaceuticals, medicals, and other information that we're able to gather, and then execute on that by reaching out, engaging, and being able to service those clients directly. We don't have to hand that off to someone else.
Great. And how do you typically work with members or clients that are utilizing your service?
So we are a phone-based company, so we do telehealth. So we utilize technology in any way we can to engage clients. Do you want to speak specifics?
Yeah, I guess we can. Telephone, I guess Sarah would agree with this, is the primary way that we connect with members. Some people like to text or email. I guess that might depend on age group or demographic or location. And some people like to email. So any means of communication that we're able to reach people, engage people, we are willing to give a try.
Yeah, so it sounds like everybody really has their own way of getting engaged with the program, and you're able to really cater to what's going to work best for a member to get them involved. And
Definitely. And behavioral health as a group of individuals is primarily been care avoidant over time. People get sicker and sicker. They are less likely to engage, less likely to pick up the phone and say, hey, I need help, or I'm struggling with something. So where our model is a little bit different is we actually outreach to them and using their claims are able to engage them based on specific episodes. And that targeted intervention has much greater outcomes of engagement. Do you have anything more to say on that?
Yeah, I think it's interesting how much stigma there still is around behavioral health. And people, it's kind of one of those topics that people are like, well, we kind of do that, but we don't talk about it directly, where we talk about it directly. A lot of times when you get a client on the phone, they're eager to talk about an ER visit, an urgent care visit, their diabetes, cancer that's in remission, but they don't mention the depression that they have or the anxiety that they're experiencing until, we can use some of those clinical skills, motivational enhancement to be able to draw some of those things out and share with them that this is a safe place and it's okay to talk about it. And depression is no different than diabetes and should be treated the same. But that's not the message, unfortunately, that society gives today.
Absolutely. Here at Benovate, we totally agree with, we need to really get to the root of what is driving somebody to engage with their health, and what are some of the root causes, and how can we get to those so that we can appropriately direct them to the right resources, such as air care. Maybe it's some other sort of clinical intervention, but really figuring out what it is that individual needs. So you talk a lot about the targeted intervention. How do you go about targeting those people and figuring out who needs to access your services? Can you talk a little bit more about that process?
Yeah, so when we partner with an organization using their data, so whether that's claims data, eligibility data, pharmacy data, and numerous different channels of data that we ingest, run against our proprietary analytics, and come up with the 25% of individuals that could benefit from behavioral health services, whether or not they have maybe it's someone that's seeing a therapist, or someone that has been to an inpatient drug and alcohol treatment, or it might be someone that is utilizing or seeking treatment through the mainline medical system. Maybe they're having panic attacks and going to the ER frequently to treat those panic attacks. Any way that we are able to find people through their claims, Sarah and the clinical team will then outreach to them and get that population to engage. And if you want to speak a little to the engagement and the approach.
Sure. So our approach to engagement, if someone's been identified either for a behavioral health need or a pattern of behavior in which we've deemed through research to be an unmet behavioral health need, we will do a series of outreach. And what we know is that individuals are care resistant. So our approach is very specific and specialized in how we do it. A lot of times, if someone is going to reach out, it seems like they are reaching out with an agenda. And that's not what we do. Our agenda is to work ourselves out of a job. So it's to engage that individual. It's to let them know that they don't have to do this on their own, that there is support. Our end game is to get them healthier and have them be happier. And we talk to clients all the time. They're like, wow, I've done this through my insurance before, and the nurse calls me and they have a checklist. And as soon as they're done with their checklist, the phone call's over. You've never asked me for anything. All you do is you give me tools and strategies I need to get better without any strings attached. And I think that therapeutic alliance, which research will show you over and over again, is the biggest predictor to an individual's success, and having them have buy-in to their physical and behavioral health is going to show the biggest improvements over time.
So you mentioned working yourself out of a job. What do those good outcomes look like for you, and how do you kind of measure yourself?
Yeah, great question. So working ourselves out of the job looks like if someone has active anxiety, we'll say, and they have a hard time even going into work in the morning. We'll talk about that. Okay, is it specialized to only morning hours that you're experiencing this? Let's journal it for a little bit. Tell me on a scale 0 to 10, what does that anxiety look like? And then say, okay, let's give you practical tools to implement, right? So instead of going back and saying, tell me about the first time you experienced anxiety and what happened, and doing the hard work, which is important, and we would absolutely resource out if need be. We're going to say, okay, maybe it's putting ice underneath your eyes right here for 20 to 30 seconds, and it instantly activates your dive reflex and takes you out of that emotional brain, the survival brain, and brings you back into your frontal cortex, where you can see things with more clarity and logic. So things that they can implement in that moment that are going to get them through the day to day. We get people often that they're like, I've done 10 years of therapy, and the tools that you've given me in the last 10 minutes have been more helpful than all of those years combined. So it's very practical, evidence-based approaches. And how we measure it is, one, what's the distress level of the client? We continuously do needs assessments. We start with a baseline and continue to do those needs assessment as we're on the phone with the client to make sure that we're trending in the right direction. We also are probably one of the only people who like to report on the results that we get. So we also track this individual through claims data as well to document that, look, their utilization has changed, and maybe now their diagnosis is in remission versus active. So there's ways in which we can show ROI on the work that we're doing. Maybe the person frequented the ER because of those panic attacks and thought they were having a heart attack. And after a couple months of working with us, they have no ER visits. Those are pretty big predictors of the ROI we've had for an organization and that we've bettered someone's life.
Absolutely. And, given all the data that you have access to and some of the tracking that you're doing via claims, which is a little bit unique to the way that you go about it, what are some of the biggest challenges that you have in getting those outcomes?
I guess Sarah and the team could probably speak to, getting people to trust, getting people on the phone. It takes probably a couple times speaking to people to get them to say, oh, this person's really here to advocate for me. This is someone that doesn't have an agenda. This is a resource that I can truly use, implement into my life. I can tell my family about this resource, and as a family, we can heal and learn some of these mechanisms to be a better working system. I think engagement, getting people to engage initially, is probably one of the bigger challenges. But once we gain that trust with people, I think it's pretty smooth sailing from there, to simple it down.
Yeah, I think that's absolutely true. When we have to work against a lot of other solicitors, right? So everyone wants to offer people help, and the trust isn't there right away. So a lot of times people think this sounds too good to be true. And if that's the case, they usually hang up the phone, right? Mm-hmm. So we have to gain that trust that when we say, there's not going to be an out-of-pocket cost for you. It's covered in your insurance benefits. It's covered as part of your employee benefits package. They go and check, and they have to validate. And I think building that trust is one of the first things that we can do to help them. And I think if we can get someone on the phone, we can make them a believer. Mm-hmm. But getting them on the phone can be a challenging component.
I have something to add.
Sure.
I think something that's unique about our solution from an engagement perspective is once a member is paired with a clinician, you are going to only engage with that clinician for the rest of the time that you want to be in the program, which I think is unique in the industry today. A lot of times you're calling an 800 number. You get some kind of operator that's going to verify your information and make sure that you are who you say you are and you have this benefit and it's covered. It's very different. The first time you call, it's going to just be a very different engagement and different experience, which I think is another reason why we're able to engage at the level that we are, is people are able to build trust over a period of time and really build a relationship with the clinician that they're paired with.
And I think to piggyback off of that, even if someone completes the program, so I had a client who had completed the program, she was struggling with depression, got her set up with the resources that she needed, and she was feeling good. Well, she was at the shooting in Las Vegas at that outdoor concert. And so she had some trauma from that experience. So instead of her having to call an 800 number again, she called me directly. She emailed me directly and said, hey, this happened to me. Can we work together again? Once you have a clinician that you feel comfortable with, you can reach out to them as frequently as you'd like. We do an outreach based on, kind of the clinical need and the risk level that the individual is displaying. But that doesn't mean that there isn't that 24/7 support if needed, even after the program has been completed. And our hope is that if we have people that are engaged in the program and they complete, if something happens, they'll call us first before going to the ER or before seeking some other treatment that maybe isn't the most helpful for them or the most cost effective on the plan.
But I'm sure that helps keep people engaged and working, towards a certain end goal by knowing that they can reach out to you and not have to go through everything all over again, start from the beginning, re-explain, what they might be going through. They just know, okay, we've been on this journey together already. We can just jump in and, figure out what the best strategy is for right now.
For sure.
Really? So it sounds like you cover a lot of different areas. Is there a certain topic that tends to come up most for the people that you're working with, or is it really just all over the board?
It's all over the board. I would say just trending with behavioral health in general. We obviously see a lot more depression, anxiety, adjustment disorders, but they're also diagnosed a lot more frequently than other behavioral health diagnoses. But I mean, we deal with anything from anxiety to,
opioid use disorder, substance use disorder,
eating disorders,
relationship problems,
it's really work-life balance. I mean, all of those different components. We have a lot of, one of our contracts specifically, we have a lot of leadership that we work with and trying to manage interpersonal relationships within the workplace and helping to coach them to be a better leader, but also to help, with some of the conflicts that might show up between their employees and how to handle it better. So it's a wide variety of situations.
And you have your chronic conditions that, your top chronic conditions that are commonly managed, a lot of comorbidities that come with that as well. A lot of people with heart disease or diabetes, a lot of depression, anxieties, different substance use disorders that come along with these conditions are also things that we have a lot of experience in managing as well.
And some people, the top 5% of the users of the plan, right? The high spenders, a lot of people are going to identify them. And someone who is just diagnosed with cancer or HIV, they're going to be an expensive member and they're going to get a lot of attention. The difference is that they talk about the disease, but they don't talk about the emotional components that go along with it. So a lot of times we work in conjunction with other vendors to make sure that the person's getting supported from all angles. If someone just gets diagnosed with cancer, we talk about, okay, because of your immune system going down from the chemotherapy, what are some hobbies that you've had that might be helpful? What are ways you can still engage with your friends or your support network without going outside of the house? There's going to be a grieving process. Let's talk about that, what to expect, what's normal. And those are things that mainline medical, they don't touch very often.
Yeah, absolutely. And that kind of holistic view of dealing with, not just chronic disease, but also behavioral health was definitely one of the areas that we got very excited about working with AirCare on. And, when you have just one kind of point of contact that you can go to not just get the resources that you need, but also do things like check your insurance information and be rewarded for doing so through the Benovate platform, that really gets to the core of how we look at engagement. That there was a very strong alignment there on the kind of strong need to be in front of people, to proactively engage them, as opposed to wait for them to come to you.
Yeah.
And when you look at air care and sort of the wide variety of services that you offer, how do you differentiate yourself most compared to just your average kind of health coach firm?
Sure. So most EAPs wait for a crisis to happen and someone to call in, and there's only about a 3% utilization rate. With ours and the proactive outreach that we have, and the ways that we're able to get in front of members and intervene before there's a crisis, our engagement rates are upwards of 30+% in our populations. So I think that's a main differentiator. And do you want to talk a little bit about results?
Yeah, I was just going to say, as a key differentiator, I think it's going back to basics of we're all people and we all have problems and issues that we face. We're all confused by our medical benefits. None of us have any idea what's going on with our medical plan. It's back to the basic of an advocate being there for you, one person that you can trust, that you can call at any time, and that can help you, whether it's for behavioral health or whether or not you just need to check and say, hey, I have no idea where to go, what emergency room I can go to, what urgent care I can go to. It's the basic need of interaction with someone that will be there for you. I think that's one of the key differentiators. That sounds very simple, but it is today.
Yeah, and one of the areas that I think we were most excited on in working with you is, we really hang our hat on the engagement front, but also in trying to get in front of members, ask them questions on a day-to-day basis, so that we can start to uncover some of those things that you may not see directly in a claim, and then we can start pushing them towards you. And it really answered an issue that we had, where we didn't necessarily have a place to push people with depression or people who are dealing with anxiety, which is one that's close to my heart. So we were really excited about that partnership. How do you see working with Benovate in terms of the kind of complete view of how you work with members?
Yeah, Benovate's been a great partner for us to work with. One, allowing us to get our information out there, and for you guys warm transferring people to us, but also for us to be able to warm transfer them to you guys. We can give them information, but if they can log in at work and interact with some of the cards that you have that are regarding meditation, mindfulness, stress reduction, ways in which they can better their sleep, their nutrition, their exercise, it's going to make an impact overall. So hearing that consistent message and knowing that we're telling the same story is a great thing for us, and that it's easy to access. I know with one of our clients, they can access telemedicine through you guys, which is wonderful. They don't have to go to the urgent care or the ER and interrupt their life for something that's maybe a 15-minute phone call with a provider via Skype. So that's been a really great partnership for us.
That's definitely.
May I ask a question real quick?
Oh, absolutely.
So I'm curious as to getting people to your service, getting people to recognize that your service is available. When is it relevant for them to actually want to pick up the phone and contact you when they're experiencing some issue, question that would be appropriate for you to solve? What do you find are the most successful triggers to getting someone to understand when that's relevant? Because when we look at employer groups and they're told about this benefit, they're typically told about it one time a year at open enrollment. people take information, but they didn't need it at that particular moment, and then they go on with their lives and they don't remember that this is available.
Mm-hmm.
Do you find, what are some of the elements that make it easier for people to retain or remember to re-engage with you at that time? Because I think that's important from a Benovate standpoint as well.
Yeah. I think the biggest thing that reminds people to reach out is if you're living your life and it's not comfortable, right? So if I am trying to live the best life that I can, and I still have this feeling of distress, I still have this constant angst, I'm not sure where it's coming from, knowing that you don't have to manage that uncomfortability or even be able to name it. But there's people out there that care and want to help you live that best life that you can. We try often to get in front of management in companies, so that way we can say, hey, these are some red flags you could look for in your employees. If you're not sure, how to offer them help or support, hand out one of our cards and just let them know what we do here.
We do lunch and learns. We do training for management staff and leadership. We also utilize companies' existing channels of communication to put out, whether it's webinars or white papers, different educational materials about behavioral health, and us being there as a resource. So we're constantly putting material in front of people to remind them that we're always there for them.
Do you find that when someone makes that first call, that first experience is typically a good one, that there any hesitation to call it a second time or in the future goes down dramatically? It's just getting people to make that first call is the biggest challenge in the initial engagement?
Well, and generally, if someone's presenting with behavioral health symptoms or a condition, a lot of times we're finding them through our claims analytics and through our risk stratification. Even if it's maybe they're a low risk individual, they have the occasional anxiety or depression that they're on medication, but it's managed. We do outreach to those individuals as well, not just high risk people. And whether or not they need our services at the time that we do reach out, we do leave our information with them if for whatever reason they ever do need to call.
And I think of maybe a really difficult time in your life. Maybe it was a loss of a loved one or a challenging life transition. Picking up that phone, it weighs 1,000 pounds sometimes. Mm-hmm. And so it is very challenging to make that first phone call. And that's why we truly believe we have a much better chance of engaging that individual if the phone's ringing, then they just have to click accept, than if they have to pick up the phone, do the work, find our number, and call. But yeah, that first phone call, as soon as someone realizes that we're not scary and that we're not in it for our own motivations and that we truly just want to help, they call back time and time again.
Mm-hmm. Yeah, absolutely. That's a huge barrier, and if you can get over that initial hump, then it sounds like you have a really good success rate with working with people. So we've had some really good questions come in. We are about out of time, but I want to make sure people still have the opportunity to ask questions. So if you do have one that was not answered, feel free to either shoot us an email or tweet it to @Benovate with the hashtag Benovate Explorers, and we'll make sure to get back in touch with you. Thank you again for our special guests, Sarah and Sophia from Air Care. We really appreciate you joining us today on Benovate Explorers. Next month on July 18th at 11:30 a.m., we'll be live from the HCAA conference in Minneapolis for the next episode of our series. So if you will be at that conference, then please make sure to stop by our booth and chat with us and tune in for the live webinar on Wednesday the 18th. As always, if you have any feedback or questions, please reach out. Thank you.
Thanks so much for having us.
Thank you.